All right. Thank you for joining us, everyone. We appreciate you taking the time out of your day to meet with us. We'll have a very brief presentation from Dr. Carl and Dr. Akampora on COVID-19 and the latest regarding the pandemic. And then at the end, we will take questions. So you can start sending your questions in now. You'll see there's a little box that says Q&A, and that's where you can send your questions to us. And at the end, we will pass them along to Dr. Carl and Dr. Akampora. If there's a specific doctor that you would like to answer your question, please note that. Otherwise, we'll let them take questions based on which one feels like they have the expertise based on the given question. So we'll get started. Dr. Carl, do you want to just take us through the latest with COVID-19?
Sure. Good afternoon, everybody. Glad you guys are here. Just a summary on COVID-19, just a primer. I mean, I'm sure most people know a ton about it already, but COVID-19 is also a coronavirus, and it's a part of a large family of viruses that may cause illnesses in humans and animals. One of the coronaviruses that we're all used to is the common cold virus, believe it or not. COVID-19 is an infectious disease caused by the most recently discovered coronavirus called SARS-CoV-2 that can attack one's respiratory system. COVID-19 stands for coronavirus disease 2019. It was first discovered in Wuhan, China, back in December, where case zero started with. And unfortunately, it is from that province it has spread globally and caused this pandemic. How is COVID-19 spread? It spreads really from person to person, unlike an animal-borne or tick-borne disease, which is blood-borne. This is a respiratory disease, and people become infected when they're near each other, and your respiratory droplets from a cough or a sneeze is exhaled or touch a surface where somebody's been and there's a respiratory droplet there, and touch our nose or our mouth or our eyes. That's an entry point. And that's why masks have become so important recently. We'll talk about that a little bit later. What makes COVID-19 different? A couple things. It's a novel virus. We haven't seen this strain before. It's easily passed from person to person. It can live on surfaces up to 3 days, different with steel and plastic, but really up for 3 days. And some questions that I got last week, which again, we'll probably talk about a little bit later, is how do we clean this and why disinfectants are so important. Again, we'll talk about that a little bit later. And before we get going on the questions, it is important to understand that this is a sneaky virus. It's neither dumb nor smart. Some of the dumber viruses that we've had before, like SARS and MERS, they actually were caused more fatalities quicker, which was terrible. But at the same time, it didn't allow the virus to spread. And neither is it a smart virus like the common cold virus, which actually it causes some infection, it causes some discomfort, but it doesn't really hurt the host to the point where the virus can't live either. This is one of those sneakier viruses that's somewhere in between. So it's very difficult for us to figure this one out. The other thing that makes this one difficult is how infective it is. I mean, it spreads from person to person quickly, not as quickly as, say, measles back in the day, or tuberculosis, which was airborne. This is more droplet-borne, but it still spreads very quickly. And the last thing that makes this virus difficult is its incubation period. We'll get into this a little bit later too. You can be asymptomatic with this virus and not even know that you have it, as the viral load is building up in your body over 2, 3, 4, 5 days when you're actually the most infectious. But at that point, you're out and about with your friends and family and as a carrier. So that's why this virus has been so difficult, and what makes it different from the other ones that we've dealt with over the years. talking about preventing the spread of COVID-19, as most of you guys know, that the best way to stop the spread of this virus is two things. One is sanitation and washing our hands with soap and water, particularly. Last week we talked about at least 20 seconds. Now I'm saying 20 to 30 seconds, actually, with warm water and soap. And if that's not available, certainly a sanitizer that's at least 60 to 90% alcohol. Purell is 70% alcohol, and that's one of the reasons it's become so popular recently. Disinfectant wipes are very important. Lysol, a lot of people are taking Clorox and they're diluting it with some water, and that's become very effective. We're not, social distancing, of course, and at least 6 feet is important. We're not shaking hands anymore. We're really not even giving elbows anymore because, again, we're getting too close to people. If possible, you want to cough or sneeze into a disposable tissue and discard rather than into your hands or elbow. Again, we're so used to giving high fives or touching elbows. We really don't want to do that anymore. We talked about staying 6 feet apart, and I'm saying 6 to 10 feet. And again, the shelter in place, really, if you can stay at home, please do. It's what's going to flatten the curve and save our country from infection. And we really need to do this as we get into the summer. Next thing we're going to talk about are masks. This has been controversial. At first, the administration wasn't as concerned with masks. That's changed over the last short period of time because what we recognized is that, and we spoke about this a little bit earlier, that this is a very infectious virus, and it's most infectious the first 3, 4, 5 days that you have it. So as the viral load's building up in your system on days 1 to 3, and you don't know that you have it, that's when it's the most dangerous because you don't know you have it, you're out and about. And even when we talk, beyond coughing or sneezing, even when we talk now, we're worried that this virus may become aerosolized and potentially cause infection. So that's why we've been asked recently, by whatever means possible, whether it's a bandana, a scarf, a surgical mask, whatever is available, we think that will help decrease spreading this virus. And I think we've already talked about hand sanitizers, at least 60%. I think we talked about diluted bleach. So what are the common symptoms of COVID-19? Of course, they continue to change. Originally, what we're seeing for the most part, early symptoms continue to include fever, significant fatigue, loss of appetite, and weight loss. If the virus if you continue to be symptomatic with the virus, it could also cause an inflammatory response. It is a respiratory disease, and when we're doing testing, the testing that's being done currently, when we're using a viral swab, we're swabbing the nose and the throat. That's where the virus mostly lands. And it is a respiratory virus. And if it does happen to land in the lungs, there's a terrible inflammatory response where we build up interstitial fluid. At that point, it's not the virus that's causing the symptoms. It's the immune system reacting to the virus. And at that point, we become terribly short of breath. And that's the last symptom that we see if the virus becomes serious enough where we have to consider sending a patient to the hospital. And this is a little bit different than, of course, it's allergy season. And so I have folks coming in and saying, Doc, I've got a sore throat, and but at the same time, 99% of the time they also have allergy symptoms, including postnasal drip. And that's certainly different than what we're seeing. And then we're still seeing some flu cases where people are coming in with a headache, a little fever, and body aches. And that, again, is a little bit different than what we're seeing with the coronavirus. facts and myths about COVID-19. Facts, COVID-19 has a higher fatality rate than the flu. There's no question about that, at least from what we know now. It seems to be 3 to 5 times higher than the seasonal flu. Of course, we're just starting to test more people now, so that number certainly may change, over a period of time. Fact number 2, will take months before vaccine available. That's absolutely true. It'll probably take 12 to 18 months to develop a vaccine to this virus, which doesn't mean that we're not working on effective treatment, which I'm sure we'll get questions about later, which hopefully will be available in the relatively near future. Facts, early reports show some promise for using an antimalarial drug to treat this disease. Well, that is true. I'm sure many of you folks have read about hydroxychloroquine, which is also called Plaquenil. We use it in this practice quite frequently for folks with autoimmune diseases like lupus. There was a doctor in France who used it on his hospital patients, and they seemed to do better than some of the patients who didn't get them. This wasn't peer-reviewed, but since that study, many clinics around the country are using hydroxychloroquine, and it does appear to have some antiviral properties. So it may be promising. We just don't know enough yet. But it does seem like it does have some antiviral properties, and if nothing else, it looks like that it will open. It sits on a receptor on the cell surface, opens up the cell to allow other things to get into the cell, which are antiviral, like certain antiviral medications and maybe even something like zinc. Myths, this virus only affects the elderly. Absolutely not true. This virus affects anybody of any age. The elderly are certainly at more risk for serious disease, as are people who have underlying medical issues, including not just respiratory issues like asthma and COPD, but also diabetes and heart disease and that type of thing. Home remedies and antibiotics can prevent infection. Home remedies, certainly not. At this point, we just haven't seen anything promising. People have tried certain things. People are even trying tonic water, which it wasn't a bad idea, actually. Tonic water has quinine in it, which I've used for gout. It is a distant cousin of hydroxychloroquine. Some people have tried it. We haven't seen any good results with it. Antibiotics is interesting. The doctor in France also used Zithromax, which is, as a Z-Pak. It does appear to have, it's a little counter, it's not intuitive at all. You wouldn't think an antibiotic would help with an antiviral, it would help with a virus, but it does seem to have some antiviral properties, and if not, potentially some anti-inflammatory properties. So we'll have to see about that. Next myth, I can catch COVID-19 from my pet. That does not seem to be true. There was one case in Hong Kong where a dog was diagnosed with COVID-19. It's only been one, as far as I can tell from my research, and it appears that the human gave it to the dog and not vice versa. Recent developments, the World Health Organization recognizes some research has shown COVID-19 in air samples. This has not been peer-reviewed. We talked about this a little bit earlier. The COVID-19 is considered a respiratory droplet disease, and the virus is encased in the respiratory droplet. Again, unlike some airborne diseases, TB, measles, where the virus is not encased in the droplet. And again, the reason that we've started to ask people to wear masks and scarves and bandanas or whatever they can use is, if you think about it and you breathe in a mirror, you'll fog up the mirror. And those are respiratory droplets. And the virus is contained in that. And if we can, if we can cover our mouths and not allow these droplets out in the air, they probably will not become aerosolized, and which would 100% stop this disease from spreading. Next recent development, a tiger in the Bronx Zoo tested positive for COVID-19. At least 3 other domesticated animals have tested positive. However, there's no evidence that the disease can be spread from pets to humans. We haven't seen that at all. We just have not seen, I haven't seen a single case in the literature that says that a human has gotten the disease from one of their domesticated pets. we do believe that the virus originated from a bat, which as it got into our system, a human system, it mutated to where it could actually affect us. But again, we have not seen any domesticated animals actually give the virus to their owner. How prepared is Virginia? Virginia will reach peak resource use on April 20th. Last week was May 20th. So this is good. So it doesn't look as bleak as it did last week. Seems like probably due to the fact that we're practicing social distancing and staying home and washing our hands, using water. It looks like that we are starting to potentially get a little bit of a handle on this thing, which is great because we certainly don't have enough beds available if this thing got away from us. 560 ICU beds will be needed versus the 329 available. Last week it was worse. 476 ventilators will be needed. Last week it was 750, so that looks better. Projected total deaths, 1,400 by June 5th. Last week it was twice that much. So this social distancing is absolutely working, which is a wonderful, wonderful thing. This gives us a chance to let the healthcare system do what it can do and help the people that truly need help. And it also really gives us the time to try to develop an effective treatment plan as we're trying to figure this thing out and hopefully a vaccine by next year. I'm very optimistic that we will have some form of effective treatment. I feel pretty good about the vaccine, though I will tell you guys, we've been trying to develop a vaccine for the common cold for 40 or 50 years, and we haven't done it yet. But at this point, we're using the entire world is putting their heads together to try to figure this thing out. How prepared? Oh, Matt, I'm gonna let you take this one.
If you take a look at this slide, Neil, and everyone, you'll see that North Carolina is essentially mirroring what's going on in Virginia. It was simply a week ago that we were supposed to reach our peak resource, and now it's going to be on April the 13th. Last week it was the 26th. So the same thing that you're seeing in ICU beds that you see in Virginia. A week ago there was 780 that were needed. Now there's 258, and the same thing with ventilators. So the thing is, as you pointed out, social distancing is very, very, very important. When they say stay at home, do not roam, we truly definitely mean it. And this is evidenced by the data that we see here in front of us. In terms of what WellcomeMD is doing, under the guidance of our medical director, Dr. Carl, and with the full cooperation of our physicians and our medical staff, we have enacted policies and procedures that basically ensure the safety of our patients as well as our medical professionals and staff. We've utilized the technology of virtual visits, and if nothing, virtual visits allow us to maintain that connection, which is so important with what we do on a daily basis. So the thing is, the fears and the concerns that are on everybody's mind, their thoughts, we have the ability to immediately touch base with our patients, and we do so. In terms of additional safety precautions, we are open, we are fully operational. So if you come to our office, we're going to meet you at the front door. We're going to take some vital signs, take a temperature, administer a mask, directly get you back into one of our offices to begin the process of evaluation. And from the beginning, from the outset, we've been doing curbside COVID testing. We have a test that once we send it to the lab, we usually have the results back within 24 to 48 hours. So we are out there ensuring the safety of our patients, which is primary to us.
All right, everybody, we're going to move on to the questions that we have received so far. And so far, we've gotten a few. Again, you can submit your questions using the Q&A box that you'll see on your screen. If you have a certain doctor that you want to answer your question, please note that. I guess we'll start. Good question here for either of you. Do you expect the vaccine to be included in the fall 2020 flu shots, or will it take a separate vaccine? And about how many months are we looking at here when we say it'll be months before we receive a vaccine?
I'll take that one. I do not believe it's going to be in the fall flu shot, and I believe it would take 12. It's going to take 12 to 18 months.
Since the virus naturally dies after a few days, can someone re-wear a mask after they have let it sit undisturbed for a few days?
Good question. I don't know if there's a direct answer to that. It may depend upon what the mask is made of. These barrier masks that we're using now are made of cloth. I mean, if the cloth in and of itself is laundered properly, then maybe they can be reused. But I don't know if there's a definitive answer to that. My guess would be to make sure that you use proper precautions.
I agree with Matt. I believe if it's a scarf or a bandana, it should be laundered properly and can be reused. They are reusing some of the masks in the hospital. They don't want to. Trust me. We would have gotten fined for that last year. But it's just a matter of practicality. There just aren't enough around, and that protection is better than nothing.
We have a question about testing. When do we think antibody tests will be available for people who may or may not have had it in January or February and just didn't know?
Yeah.
The antibody testing should be available in the next 2 weeks. It's several manufacturers are manufacturing hundreds of thousands of kits as we speak. It's going to be a very valuable test in addition to the testing we're doing now. The testing we're doing now is called PCR testing, which is called polymerase chain reaction. It amplifies the virus's RNA, and if it's positive, it's positive. Sometimes these tests are negative the first day or two. There's not enough viral load, and that's why we're getting some, quote, false negatives when somebody actually does have the virus. But if somebody comes in probably 3 to 5 days after symptoms, that's when their viral load is going to be the highest. And this test should be pretty accurate. The initial screening test, which we have now, the newer test, the antibody test, which the question was about, is a neat test because it doesn't measure the viral load. It measures what the body's response to the virus and if we've developed antibodies. And this is important for several reasons, but one of the main reasons it's important is to try to figure out if after a while we've developed immunity. If we've developed immunity to this virus, whether it's IgM or particularly if it's IgG immunity, where our adaptive immune system starts to remember this virus and can attack it if it happens again. I mean, that's terrific, and that might be a sign, along with how many hospitalizations there are in a certain city, of when we can potentially get back to work. So I think it's a very important test that we're going to use in parallel with the screening test that we have now. And by the way, the screening test is going to be we're going to have the same technology where we use a viral swab and check the nose and the throat, where we're looking at the virus's DNA. We're going to have a very similar screening test coming up soon, where we can get folks an answer within 5 minutes. Whereas now, they get the screening test, we have to send it off to a lab. Depending on how quick the lab can get it back, it could be 2 to 5 days, and people are in limbo. So we're going to have a better screening test, and we're going to have a new antibody test coming on the market probably within the next 1 to 2 weeks.
We have a question about the weather. Of course, we see this happen during flu season. Is there any evidence to believe that the virus will wane during the hotter weather that we have coming up?
Not because of the virus itself. The virus doesn't appear to necessarily be temperature sensitive. Now, we'll have less of the virus just because we're outdoors more. And there is some potential evidence that the virus may be susceptible to UV sunlight, but not the temperature itself. Matt, do you have anything?
I echo
that?
your same sentiments on that. There's nothing to show that it's temperature sensitive.
Yeah, we haven't seen it. Yeah.
We do have a follow-up question about UV rays. Has there been any validity so far to UV rays being able to kill the virus?
There's a small lab in Colorado using UV rays in B2 to see if it can kill this virus. And preliminary reports say that there are some positive preliminary results.
Is it possible that if someone was sick, as well as others in the workplace with typical COVID symptoms in mid-January and tested negative for the flu, is it possible that that could have been the virus?
It's the million-dollar question. It seems a little too early for that to have been true. But it will be neat to get this antibody test on the market and see if that is potentially true. But we don't know the answer to that yet. It doesn't seem likely, but it's not impossible. You know, did people get out of China with airplanes? It's possible, but we just don't know yet. We just don't know yet. The antibody test will be able to help us quite a bit with that.
We have a question about food and having food delivered to the home. When someone has food delivered, is it safe to eat colder food, or does it need to be, do we prefer that they get warm food that can be warmed up that could possibly kill the virus? Or is it okay to eat, say, a salad that gets delivered to your house?
Matt, I'll let you take that one.
Yeah, again, I think it's safe to eat food of any temperature. There's been nothing that I've seen in any of the literature with regards to this disease of it being sensitive to, in foods to temperature at all. So I would say if you use proper technique in terms of, procuring the food out of the device that it's in, making sure that your hands are washed before and after you eat, I think you'll be fine. I don't know, Neil, have you heard anything?
No, that's about as much as I'm hearing. People are just using common sense and using sanitary methods for both their hands, their food, and and wiping down the boxes as best they can. I haven't read of any cases where somebody's actually developed COVID-19 from. I'm not saying that it's impossible from bringing in a box from outside from Amazon. I haven't read that anybody's gotten it that way yet.
When treating symptoms, what have you, either of you, seen about acetaminophen versus ibuprofen when it comes to treating symptoms that are related to COVID-19?
Well, it was recommended a couple of weeks ago to avoid the NSAIDs, which would be Advil, or ibuprofen, and those types of medicines. With the thought process being, we don't want to decrease inflammation, right? Our innate immune response is an inflammatory response. So if we put something in our bodies to decrease inflammation, like Advil, then potentially it would decrease that initial innate immune response. And so some of the medical community is arguing not to do that, and it probably makes sense. I'm not sure about the Tylenol per se, the acetaminophen. Matt, have you heard anything about that?
I haven't heard anything negative about it. And again, this is all something that is not necessarily peer reviewed, so we have to be really very, very careful. But I haven't heard anything with regards to Tylenol.
We're getting a lot of questions about masks. Just first of all, should people be wearing masks when they just go outside for a run or a walk?
It's very difficult to wear a mask running. So the thing is, I think that you have to be very, very careful with regards to that. I think if you're going to be in public places around someone, supermarkets, parks, etc., that yes, you definitely should mask up.
And then as far as reusing masks, is it better to clean a disposable procedure mask, or is it better to use a cloth mask that you can then wash?
I would favor the use of a cloth mask than you could wash, because again, you can kind of gauge how well that garment is or material is cleaned or not. But with these other masks, you really can't. So the thing is, how do you clean them? What do you clean them with? What is the process? So I think that the cloth masks would be better.
We have a question
Well,
about.
the surgical masks are they're a better filter, but I mean, practically speaking, they're hard to get. So,
Yeah.
it's just very difficult to get. So I mean, it just so a cloth mask with good laundering makes great sense.
Yeah. Agreed.
Other than the heart and the lungs, does the virus compromise any other organs like the kidneys or liver?
They did an animal study 2 or 3 weeks ago, and again, the majority of the virus was seen in the nose, the throat, and the lungs. But they also saw the virus in the heart, in the musculoskeletal system, in the kidneys. So it's not that it doesn't go other places, but the main receptors for this, quote, respiratory virus are in respiratory organs. It uses a receptor called angiotensin II, and most of those receptors are more on the respiratory organs, but it can get into other organs.
Talking about the antibody test that we discussed earlier, is that going to be something that anybody can get, even if they're not showing symptoms?
Probably not initially. They're probably going to use the antibody test in the areas of the country where the virus is most prevalent. They're going to certainly use it with the healthcare workers and nurses and anybody who needs it most. I mean, listen, guys, it would have been optimal and perfect if we had a test that was 100% sensitive, 100% specific, and everybody in the world could have gotten it at the same time, and we could have quarantined people who needed to be quarantined. It just didn't play out that way. And so this antibody test is going to be very helpful in helping to decide if you have the virus or did you have the virus, and then beyond that, are there some possible immunities to it? But as far as everybody getting it immediately, it's going to come in waves. I think the people who are symptomatic and need it the most are going to get it first, and then other folks will. There's going to be plenty of them, but other folks will probably not get them. They won't be first in line, but we're hoping that the entire country is going to be able to be tested at some point.
Neil, do you feel the clinical utility of that antibody test is actually involved in future potential outbreaks, not necessarily the one that we're in now?
Well, potentially in the sense that this COVID-19 is a coronavirus. So it's, we got 4 different coronaviruses, 5 different coronaviruses out there. So from that standpoint, it may be helpful, particularly as we're trying to develop a vaccine.
Mm-hmm.
Yeah.
We have a couple questions about symptoms. First of all, if someone is asymptomatic, will they eventually get symptoms, or are there some people who carry it and never get sick?
25% people don't get sick.
Sick, right.
And that's what makes it so scary. They're still the carriers. They don't know they have it. And again, that's why the masks have become more important.
And then,
and particularly the young people. Yeah, but yeah, particularly the young people. They absolutely don't know. Majority of if they have it, it's such a little tiny cold that they don't think twice about it.
And then we saw our chart earlier, specifically when it comes to allergies. How do you tell if the symptoms you're experiencing are allergies or it could be something more serious?
Well, I mean, first of all, I mean, I guess, do you have a history of seasonal allergies? And did they generally happen this time of the year? And if that's the case, it's probably allergies. Number two, if you think that there are allergy symptoms, which include watery eyes, runny nose with clear drainage, sneezing, maybe a little bit of a sore throat, and then you take an allergy medicine, whether it's any type of antihistamine, Claritin, Zyrtec, or a nasal steroid like Flonase, and your symptoms get better in 2 days, it's probably allergies. Obviously, if the symptoms start with that and they worsen over a period of 2 days, 2 to 3 days, where you start to develop, cough and fatigue and weight loss, and if at that point, then we have to consider it something other than allergies.
Going back to people who are asymptomatic, this is a very good question. If someone contracts the virus, how quickly can they spread it to another person? And if they stay asymptomatic, if they're one of the 25% that don't get sick, how long are they carriers of the disease?
Great question, actually. My research has shown that folks that are asymptomatic are actually most infectious the first, from day 3 to 5, probably. The first couple days that they have it, if they have no symptoms or light symptoms, there's probably not quite enough of a viral load. The viral load seems to peak around day 3, at which time, again, if they're asymptomatic, they have no idea. They're out there just hanging out with their friends and family, but they are 100%. They are absolutely passing that virus on to somebody else at that point. What was the second part of the question, Ryan? I'm sorry.
And then how long are they carriers? Are they carriers for, say, 2 weeks, or is it a certain number of days, or is it going to vary from person to person?
The animal studies have shown so far that the viral load peaks around day 3. And when they've retested in the animal study at day 28, the virus is gone.
When someone starts showing symptoms, at least in terms of what we do with WellcomeMD, if someone starts showing symptoms, at one point, are they able to get a test? And do we have enough tests that we can administer?
We certainly have enough tests in our office in Charlotte to test our patients. So if after a significant history that we take and they are manifesting symptoms, they may have an association with someone who has been either tested positive or has symptoms, we can test them that day.
Is it the same in Richmond, Dr. Carl?
Same here in Richmond.
Yeah.
Okay.
Same in Richmond. Yes.
Talking about immunity, someone asks, how and over what period of time can you measure immunity?
Well, as we spoke about a few minutes ago, you develop the virus, and your immune system has 2 parts to it. One is called innate immunity. We talked about that a little bit earlier, where you have this aggressive response to the virus, and you try to get rid of it through multiple different types of white blood cells. At some point, the white blood cells chew up this virus and pass it on to the other part of the immune system, which says, this is what this virus looks like. Let's start making some antibodies to it. These antibodies are called IgM and IgG. And generally the way it works for most diseases that we have, our immune system has a memory. And if this virus is seen again, our immune system says, I know that guy. I've seen that virus before. I'm going to attack it immediately before it starts to hurt me again. And that's part of our adaptive immune system. We don't know what's going to happen with this virus yet. Is it going to be more like something that we just talked about, where our immune system recognizes this virus quickly and can just knock it out and we've developed immunity? Or is it going to be the type of virus that mutates every year? And even though we've developed some, quote, immunity to this strain, it may become another strain and we've got to start all over again. So we're just not sure yet. And, that's why we have to change the flu virus every season, because it's a pretty darn smart virus. It mutates all the time. This one doesn't seem to mutate as much as the flu virus, the seasonal flu virus at this point. But I tell you guys, this one is so novel, so new. The playbook is changing every day. And we're just starting to get a little bit of a feel for what this virus can do. But we don't quite have an answer on the immunity piece yet.
Yeah, I feel that Dr. Carl raises a good point about mutation. Sometimes mutation of a virus is not necessarily a bad thing. It may weaken the virus. And as you pointed out, this virus does not mutate. So something to be concerned about.
We still have time for a couple more questions if you want to submit them through that Q&A box. Dr. Carl, you kind of talked about, and either of you can touch on this. We're seeing research kind of come fast and furious here. It seems, you look every day, you have some sort of research or some sort of peer review of previous research coming out. Is that just because everyone's kind of dropped what they're doing and everyone's focused on this virus and we've got the best and brightest working on it? Or, is there still other research being done, or has everyone kind of stopped what they're doing to focus on this?
Well, I think that what's happening is you're seeing global cooperation like you've never seen before. So as Dr. Carl and as you pointed out, Ryan, you're seeing that cooperation from all over the world, which is, to me, very unprecedented. And people are sharing things through conferences such as this, what their findings are. So the thing is, I think that it plays a huge role, and a very, very positive one, in terms of our ability to really grab hold of this and wrap our arms around it. Well, not in a social way, but no pun intended, but to really get a hold of the virus and hopefully defeat it.
And I second that. I agree with that. It's hopefully there's going to be some good that comes from this. We're going to be able to use technology to our advantage as we track this, and it is just to come together and as a country and as a world to develop this community effort. It's just been incredible. We do, as human beings, we do cause a lot of problems, but we're really good at fixing problems. So it's just so great to see the best and the brightest working on this project. And I am cautiously optimistic that we're going to have some kind of effective treatment for this, in the very near future. Not a vaccine per se, but an effective treatment.
We do have a question just about mixing your own disinfectant in terms of how much sodium hypochlorite or Clorox to add to water. Is that the same that we talked about with bleach, where it'd be 1/3 of a cup per gallon?
1/3 of a cup per gallon, or 4 teaspoons per quart. Mm-hmm.
What would you guys what would you guys recommend to improve the immune system in terms of diet and exercise, as we're all kind of, sheltering in place?
Well, I'm a big component, huge component of clean eating, plenty of fruits and vegetables, daily exercise, sleeping 7.5 to 8.5 hours a night. And really, the big thing now is stress control. This is a very, very difficult thing for everybody. The social isolation. We're not built to be socially isolated. We're built to be around other people and be social. And so this is very difficult for people. But it's something that we just have to do. We have to hunker down and do what we're doing to stop the spread of this virus. As far as supplements, I still think for the most part we can get it through good diet. I mean, the immune system always responds well to vitamins A, vitamin C, vitamin D, vitamin E, zinc, and iron. Those are well-known supplements for anybody's immune system. Again, you could get most of it through diet. if there's a deficiency, we certainly want to supplement for that. But like you suggest, Ryan, other than that, we have to build our immune system just through making good choices, and we have the time to do it now. So it's actually a good period of time we can develop an exercise program for ourselves and start to work on some of those things that we've always wanted to work on to better our health. And we have to, in some ways, let's take advantage of this time if we can.
Yep. And we are working on a couple of future webinars from Luis, our health coach, and Amanda, who's our exercise physiologist, on things you can do at home to maintain your diet and exercise while we're sheltering in place.
Perfect. Makes sense.
We have a question for you, Dr. A. Earlier, you mentioned that it doesn't look like COVID-19 is mutating, and you said that it might be worse. Could you just elaborate on that a little bit?
Well, sometimes when viruses mutate, they become weaker. And it's actually, as Dr. Carl pointed out, the COVID virus has not done that, or doesn't do it as the other viruses do. So that may present a problem. It may be more of a stronger, may become stronger, more virulent.
Well, just to talk about that, maybe not, Matt. In some ways, if a virus continues to replicate, sometimes at that point it gets weaker and weaker and potentially could die out. So it could actually work in our favor in some ways.
Okay.
Mm-hmm. All right, it looks like that is all of the questions that we have so far. Do either of you have anything else that you want to add before we get out of here?
Nothing.
Good. All right. No, just thank everybody for tuning in. I hope this information was helpful. Again, we Dr. Acapor and I talked about it. It's a different playbook every day. We're learning as you guys are learning and trying to get the information out as soon as we can. It's a novel virus, but we are learning more and more about it each day, and we're going to beat this thing. So hopefully you'll stay patient, stay well, stay healthy, and if you need us for anything, please call us.
All right. Thank you to both of you for your time. Thank you to everyone who took time out of your day to join us, and thank you for all of your great questions. As we've said before, WellcomeMD is staying open to help all of our patients during this time. If you have any questions about adding a family member to your plan, or if you are interested in becoming a WellcomeMD patient, you can learn more at WellcomeMD.com. We are accepting new patients. We are accepting new family members in. If you are concerned about their health, please get in touch with us if you have any questions about that. Thank you all, and we will be doing these again to keep you updated as we go along and get through this pandemic.
Thanks, Ryan. Thanks, Dr. Acapora.
Thank you. Thank you.
Thanks,
Neil.
guys. Thank you.